Hello, I'm Dr. Bill Owens, and I'm very excited to have one of my colleagues who I've known for a very long time, and I learn quite a bit from on a day-to-day basis. Dr. Eric Lee. Dr. Lee, would you just give everybody a quick background on where you are, where you practice?
Oh, Dr. Owen, you're a great friend. So I'm Dr. Eric Lee. I practice in Lehigh, Utah at Summit Brain, Spine, and Orthopedics. It's a neurosurgical and orthopedic practice along with spine management, which is my role in the practice, my foundations in chiropractic and my graduate trainings in spinal biomechanics and trauma.
I think you have a very interesting case to share with us. Would you mind taking us through it? And I'm excited to see
Sure.
it.
So this is a case where I thought it would be interesting because this is a motor vehicle collision that happened early January of 26. And she went to the urgent care, went to a chiropractor. Um, Treatment was hurting her, went to physical therapy. Treatment was hurting her, so I had to stop. Went to a neurologist. They uh, performed some trigger point injections, also had a cervical epidural, and there was only MRIs ordered. So a few months later, they're referred to the neurosurgical team in our office where the MRIs were unremarkable. No, nothing for surgery, no decompression needed to be done. Referred down for me for analysis. They then ordered x-rays because there was none taken. And so this is the x-rays that were taken from a imaging center we had. So we're able to just see these, and there's things that jump out right away. This was interesting because none of these x-rays were ordered back in January. Here it is not till May of this year, and she's been suffering, very difficult for work, difficult for her to go to school. So we then sent them into SpineCAMP to have them analyzed. And as you can see, and I'm so impressed that you're able to look at these markers. One thing is when we get these sent in, it takes literally seconds, as you know, Dr. Owens, to have this completed. That's such a time saver in the clinic. You can see the different colors here. I can individually look at each segment and go through and say, all right, this one's giving me really correct numbers. I can actually use all the tools to do what I want to look at them. But one thing that was interesting is that I did see the report that was generated by the radiologist. It was the strengthening or straightening of the normal cervical lordotic curvature. There may be some spine sprain or some ligament sprain. Um, they mentioned C3 and C4 and C4 and C5. They don't really dive into it because they don't have the time to really do all these measurements. So I look at the SpineCAMP report, and when I see this, it tells the story, right? We're taking this data to tell the story clinically of what we want to do next. Here it shows the 3, 4, and 4, C4, C3, C4, C4, C5. The translation is over 3.5, which, as we know in fifth edition and other editions, this is not normal, which is highlighted here in red. Also, which is important, is it shows 3.1 at C2, C3, which is also important to us clinically, even though it may not be in the red, but you can see in the angular motion that, hey, this is something that needs to be addressed. Now, with her symptoms after a physical exam and everything, this totally correlated with a ligament pathology. So every time she was to do any exercise or anything, it would hurt. And so when we look at this and we go, there's a ligament pathology, and if it's still injured, you're going to step back a second and look at how am I going to go about with the treatment protocol. It will change physical therapy. It will change the way a chiropractor will adjust. And so those are things that are very, very important to me. But number one, It's very fast. So I can make a clinical decision. It's unremarkable when we have that ability to do that, not taking hours to come up with this. This patient, just after a couple of weeks, Dr. Owen, was the first time she had a headache go away. Okay, so a student that has headaches is not good.
No, no, that's not for the long term. And, and this is such like, it's such a common occurrence, right? The reality is like a lot of these patients, providers think that it's in their head when, literally, like, in all joking aside, it's in her neck, right? You're in a high paced, very complex clinical system. And, do you feel that an automated, artificial intelligence, sub-millimeter measurement tool like this, does that help your reputation?
I would agree 100%. It's now where there's other spine surgeons will ask for my input mechanically because they're making a decision about a disc replacement or a fusion. And if they do a fusion, what's the likelihood of a pseudoarthrosis? There's so many clinical aspects that I get asked now just because of this biomechanical knowledge. And I can't make those decisions unless I have a very good report or if I have very good technology give me those exact numbers. And so
Yeah,
that's
100%. And
100%.
now this is a medical legal case.
Yes. Yes.
Are you comfortable with these numbers from like a defensibility? Like if you're on the witness stand.
Yes, because now we're able to describe the causation and the pathology with it, which is a ligament pathology. So now I have all the information of what that's going to do and dive deep into that's the problem. So when you have this to correlate with that clinical reasoning, you can ask me questions for 8 hours. And I've used these on depositions to where explaining like why they still have problems, why are they still having these symptoms, why is certain treatments not working, and why they might need future treatment. And so now we have a clinical reasoning, and this gives us the data that we can use that to do.
Yeah, and it's a third party, right? It's not Dr. Eric Lee saying these are my measurements. These are the measurements that come out of a validated tool, and you're applying them to this patient situation. And I think there's a lot of power in that.
Sure. Yeah, absolutely. And you need a tool that can be very exact and precise to do that.
This was great. I certainly learn every time I see a case presented. I always learn from you. All right. Well, thank you, Dr. Lee. You have a great day.
You too, buddy. Always good seeing you.